Hey everyone, my name is Liz Rektoric. I did my change project on decreasing rates of sternal wound infection in cardiac surgery patients. The aim and outcome of this change project is to decrease rates of sternal wound infection in patients following cardiac surgery by 50% in the next 6 months. To do this, implementation of a new policy regarding infection control will be utilized. This policy became effective July 1st, 2016. In addition, surgeons and nurses will be educated on the new policy and best practices, and patients will be thoroughly educated on proper post-operative care. Jennings et al. Stated, sternal wound infections are potentially fatal and at the very least costly, requiring antibiotic, surgery, or both. At Mercy Hospital, we have had a recent increase in patients being readmitted with sternal wound infection. Deb Lawler, who is a clinical nurse specialist at Mercy, who was hired to specifically research and help lower incidence of sternal wound infection, informed me that within the last 18 months, we have had 21 cases of sternal wound infection, and in the 18 months prior, there were only 7 cases. That means from January 2015 through June 2016, sternal wound infection rates were up a staggering 200%. While there are factors independent of our control, there are also factors dependent of our control that are under the control of healthcare professionals. These include proper preparation of the patient's body, proper nasal antisepsis, antibiotic prophylaxis, best practices of surgeon and surgical team, such as change down of gloves and gown by surgeon after takedown of the internal mammary artery under 100 minutes of perfusion time, normal thermia intra-op, and air quality in the OR. Post-operative dependent factors also include managing hyperglycemia and keeping blood sugar within normal range, use of Prevena wound management systems, daily chlorhexidine baths, thorough patient education regarding post-op care, and sternal wound precaution adherence and education. Lepeltier et al. Stated, the pre, per, and post-operative prevention strategies associate controlling the patient's risk factors, preparing the patient's skin, antimicrobial prophylaxis, environmental control of the operating room and medical devices, and adequacy of surgical techniques. In the new policy at Mercy Hospital, Prevena wound management systems are now to be placed upon closure of the sternum in the OR on all female patients as well as patients with a BMI over 30. Use of Prevena wound management systems can prevent incidences of sternal wound infection by creating a light suction which can pull exudate from the wound. The silver impregnated Prevena also serves to prevent further bacterial colonization of the wound, with the Prevena remaining in situ for up to 7 days. It further prevents wound contamination as traditional dressings can easily come off during this time. There are multimodal aspects for prevention of sternal wound infection. These include the patient's skin preparation, nasal decolonization with miripocenine, antibiotic prophylaxis, barrier measures in the OR, and compression devices to prevent post-op wound disunion. Here you can see the old policy versus the new policy regarding care of the open heart surgery patient to limit chances for sternal wound infection. Briefly just going to go over the new policy. Regarding patient prep, the night before surgery, the patient is to be clipped. They are to shower with HiPoCleanse. The bed linen is to be changed. And then in the morning, this is the important part of the policy, in the morning, the patient is wiped down with CHG wipes from their neck until their ankles. And then on the front of the chart, actually, there's a spot where the nurse is to document that that was done. And the surgeon will not even bring the patient to the OR unless that is documented. Regarding nasal antisepsis, it's given 12 hours prior to surgery and then again on call to the OR. The new policy regarding the surgeon, that they change their surgical garb after takedown of the internal mammary artery. Regarding the Prevena, instead of only putting it on patients with only a BMI over 30, now they're to put it on all female patients and then, of course, patients with a BMI over 30. And then in the old policy, there was no talk about CHG baths at all. And then in the new policy, the open heart surgery patients are to receive a CHG bath daily until discharge. This slide briefly talks about patient education. This is what we tell our patients, and we really try and drill it into their minds as before they get discharged on how to properly take care of themselves. We tell them to shower every day, wash their incisions with soap and water, and pat the incision dry. Maintain sternal precautions for 6 weeks. Never itch the incision. Wear a clean shirt every day. No tub baths or swimming until sternal incision is completely healed. They are to wash their hands frequently and not let any animals lay on their chest. Brace their sternum while coughing. Look at the incisions daily. If you notice any drainage, redness, oozing, or tenderness, they should let their surgeon know immediately. And then use of the incentive spirometer. All these things can greatly decrease the risk of the patient having a sternal wound infection post-op. To implement this plan, the plan is to educate. The new infection control policy was in effect July 1st, 2016. This was developed by the Director of Patient Safety, Clinical Nurse Specialists, and Infection Control Specialists. The plan is to educate surgeons and nurses on infection control policy changes and reinforce key areas of best practice. For surgeons, it is mandatory to change the surgical garb after takedown of the IMA. Mandatory use of Prevena wound management systems in all female patients and patients with a BMI over 30. For nurses, mandatory clip and prep the night before surgery. The CHG wipes morning of surgery from the neck to the patient's ankles. Mandatory nasal antisepsis. And this is to be done and documented in the front of the chart. And then to maintain the Prevena dressing post-op for 5 to 7 days. This is including all healthcare personnel who care for cardiac surgery patients, and they are to follow this new policy. This policy started July 1st, 2016 at Mercy Hospital of Buffalo. It's implemented in both the open heart unit and on my unit, which is 7 West, which is the cardiovascular floor. To do this, we're going to enforce the policy changes with surgeons and nurses and hold them accountable. We have the support of management. Management is on board. My manager has obtained the warmer for the wipes, as they are to be kept at a specified temperature of 125 degrees Fahrenheit. Our goal is to reach 100% compliance for nurses' education. Nurses are educated through net learning and read and learn activities, as well as through classes put on by the clinical nurse manager. As of July 10th, all nurses were in 100% compliance that they completed their education. Also, the OR staff is to document in the chart whether or not the surgeons change their garb after IMA takedown. To study this plan, the prediction and the goal is to decrease sternal wound infections by 50% in 6 months after implementation of this new policy. The fact that this just started as of July 1st, and we are still in its beginning stages. However, there are some preliminary results. Nurses report they feel more knowledgeable and better equipped to care for cardiac surgery patients. To date, there have been no patients with sternal wound infections that have been readmitted to the hospital. There is clarity on pre-op and post-op care, and during discussion of policy changes, nurses have shown interest in doing things the right way. Nurses feel empowered through education and feel like they can truly be a positive force in preventing sternal wound infection. To act on this, we have to keep doing what we're doing. There's no need for modification at this point. We need to sustain the change for continued improved effectiveness. We have to continue enacting policy changes with surgeons and nurses, improve patient hygiene compliance through patient education and post-operative care, continue discussing policy changes with staff, and reinforce to sustain new policy guidelines. The purpose of this change project was to decrease the instances of sternal wound infection in patients post open heart surgery by 50% in 6 months. Being that the new policy on infection control in cardiac surgery patients was effective July 1st, 2016, conclusions on whether or not this goal was reached is not yet available. By educating all healthcare personnel on the policy changes and by educating patients on how to care for their incisions after discharge from the hospital, we are hopeful we will begin to see this decrease of sternal wound infection instances by the end of this year.